we've got, this is a story from about a month ago. Labour would tear up contract with GPs and make them salaried NHS staff. Planned overhaul for GP surgeries. There's an attack on GPs by Wes Streeting and the Labour Party, and then this week, GPs are banned from saying call back later. So we've got another. This is a government through NHS England, I think, saying that GPs can't just say, well, we'll get back to you, which just seems a bit harsh if they've got so much to do. I wanted to understand why both of the main parties are attacking GPs. So I thought I'd bring on our favourite GP, Dr. Bob Gill. How are you doing, Bob?
All good, thank you, Crispin.
Now, I think you covered a bit. We've covered a bit on this attacks on GPs. I mean, we've got this story, and it's in the Morning Star this weekend as well. Ministers warn to ease GP workloads or see NHS collapse. This is from the Royal College of General Practitioners. So there's an acknowledgement by GPs that GPs are overworked, and then the government says you've got to answer back and straight away. Labour saying we're going to take you off the payroll, whatever, give you a different status. Why are they attacking GPs? GPs aren't the problem, are they?
So we need to put this into the context of the end game, and the end game is to turn the NHS into a series of assets. And the only way you can maximize profit once you've created these assets and handed them over to corporations is to have a cheap, compliant workforce. Now, the status of GPs when the NHS was formed as independent contractors, but all their terms and conditions agreed within the public health system, well, that delivered extremely good outcomes, and you had professionals with autonomy. But what we also had was a great deal of continuity of care, expertise, and a relationship between doctor and patient. Now, that doesn't suit the business model. The business model requires the patient and the professional to be separate, for there to be a whole series of intermediaries designed to prevent the delivery of care. That's the model. What Wes Streeting, or whoever the shadow Labour person would be, the script is the same, because all major parties have decided that they want the Americans to take over the control of our healthcare system, and they want to turn it into a cash cow. So hence, you need to break the fundamental role of the GP, which is the foundation of the NHS, to have an expert first point of call is now becoming a rarity. Now you're diverted to 111, or you might not get to see the GP. So it's already very fragmented, and they want to finish off the job. So Labour are totally on board with that direction of travel, as they have been over the last 3-4 decades. They haven't obstructed any of this change. Coming to the article, I believe it's from the Telegraph. What that article does, not only does it need to scapegoat GPs, and Kit referred to, narrative management. This is all part of the nudge, drip, destruction of confidence in the service. We must not forget, GPs have been set up to fail. What were we asked to do when the pandemic struck? To shut our doors. Unfortunately, most of us complied. Now that was the start of creating a problem with workload pressure and backlog. So that was a huge own goal by the GPs. They made a mistake. They trusted government. They thought maybe they had some rationale around doing this. And now the right-wing press have seen that there's a build-up of demand, there's growing dissatisfaction, and they need to keep hammering the nails home that the GP service that we've traditionally had is no longer any good, and we need to shift over to something else. So it's very coordinated, this nudging, this scapegoating. And there's no doubt the service is dire, and it's getting worse because, GPs don't work in isolation. If the hospitals aren't functioning, if you've got millions of people languishing on waiting lists, if you've got people on more and more drugs, well, that increases the amount of workload on a shrinking workforce. So of course it's in crisis. Unfortunately, the BMA have been very timid. It's refreshing to see the consultants who have now balloted for strike action coming out very strongly. We already know the junior doctors came out very strongly. The GPs have been the weak link within the profession because they have been used to destroy the NHS. You know, when the subcontracting and clinical commissioning groups came out, GPs were the front men for axing hospital services. And for a short period, we were treated very well, incomes went up. But now the dirty work has been done using GP frontmen. It's now time to pull the rug out from beneath the GP profession. And, you know, the way to do that is to constantly undermine. But, you know, this shouldn't be a surprise because the 2022 legislation, the creation of these new public-private partnerships, require a fully salaried service. And that's all Wes Streeting is saying. He's saying, you know, business as usual, let's complete the job that we're agreed on with the Tories. So a couple of other points about that article. So number one, scapegoat GPs, reinforce the scapegoating. Number two, impose a new contract which will accelerate the self-destruction of general practice by signaling to the patient, well, these alternative services are just as good. You see, so you end up getting doctors endorsing the downskilling by saying, go to 111 or go to urgent care. So GPs are in effect endorsing the fragmentation of the service they used to provide. So self-destruction. There's also reference in that article about, oh, you know, there's an increase in stroke and heart attacks because people haven't gone to see their GP. This is utter baloney. This is bogus. This is misinformation. Because these drugs, statins they keep talking about, statins have a very weak beneficial effect, which builds up over years. And we heard Chris Whitty trying to blame the increase of strokes and heart attacks on the lack of statin prescribing, but that's a total diversion. What they don't want us to do is think about the effects on health of economic meltdown, the effect on health of the lockdowns, and the effect on health on controversies around the vaccine, the mRNA vaccine. So they need yet another diversionary tale to tell. And that's why they keep bringing up statin prescribing. And, you know, the final thing is, I'll give you an example of just how weak the effect of statins are. If you give a statin drug to somebody who's already had a heart attack, so very high risk, and they took it religiously for 5 years, how much do you think it will extend their life expectancy? By 4 days.
Wow.
These are pathetically weak drugs that we are constantly brainwashed into thinking there's some miracle cure. So once you understand that they're peddling nonsense and they're, you know what, the tricks they are deploying are constantly the same, reinforcing the changes that have already been made, always scapegoat somebody else. If it's not immigrants, it's the professionals, right? And bigging up pharmaceutical industry. These are the common themes, I'm afraid.
Well, I mean, we also talked before about the way they're trying to give contracts from GPs to outsource them to private companies, and some of those have got, what was the one in London that's got like 300-400 practices? Is that right?
Yeah. So there's an American insurer who called Signet Health. Centene.
Yeah.
They're an American insurer, and they bought out a consortium of GPs who had already amalgamated many practices within London. And now Centene, an American insurer, is the biggest provider of primary care in England. So this is not some hypothetical threat. And now you brought me onto that subject. Within a period of 2 weeks, I received as a GP 4 letters from 4 private companies offering to buy me out.
What?
Yes, and we should do another piece just on that article, just on that issue. So the vultures know, the vultures are circling. They know that GPs.
So they're running GPs down, demoralising you, and then someone's saying, "No, look, we've got this money and we can buy you out and whatever." It's just it's coordinated, isn't it?
Exactly. So what these companies are doing, they're only an intermediary. What they want to do is capture control of the patient list, the capitation, because money follows a patient, right? So you have these entrepreneurial schemers going around knocking on doors saying, are you fed up enough? Are you at the point of reaching for the retirement switch?
Whoa.
We'll buy you out. Yeah, that's what's happening. And in a couple of years' time, they will just sell it on to Centene or to United Health. So there's an asset grab and a consolidation which is rapidly progressing. It's accelerating. And Streeting and Starmer will not mention this at all.
I mean, that bit that you just said, we have to do something on that development, that they're just out there waiting to take on your work, and they're undermining you. It's so dark what's happening. Thank you so much for coming on.
The most tragic thing is the GPs themselves haven't got a clue what's going on. And who do I blame? The British Medical Association for their imposed ignorance on the profession, like the other health unions. Thank you very much.